Hello, my name is Dr. Brou. I'm a plastic surgeon in Oklahoma City, and I wanted to address a question that we always get asked, and that is, am I a candidate for a mini tummy tuck or a regular tummy tuck? And that's a very good question, and we often face that issue with patients. And I'm going to explain the difference between those two so we know the answer to that question for your particular case. So, a mini tummy tuck is an abbreviated version of a tummy tuck. But the main thing that a tummy tuck corrects is the excess of skin in the tummy area. So, if you do have a lot of excess of skin in the tummy area, you're most likely not going to be a good candidate for a mini tummy tuck, but more a regular tummy tuck. And the big difference is that in a mini tummy tuck, you really try to minimize the scar. Whereas in a regular tummy tuck, you use the general or the generous scar so we can get rid of most of the skin. So looking at this diagram, for instance, there's several things I look at in a tummy. Number one, and most important, is the excess of skin we can see in this area. And a lot of patients that come to see me, they will have a very prominent fold. There's no good diagram for that. But going back to this, when the tummy has very little extra skin and very little extra fatty tissue, which can be addressed mostly with liposuction, and oftentimes when you have a previous scar from a C-section, that's a good candidate for a mini tummy tuck. And what I do is I expand this incision so we can get rid of that dimple that usually these scars cause, and then repair mostly the muscles in the lower tummy and leave the belly button attached. And that's the key issue or the key definition of a mini tummy tuck. So it basically addresses the lower half of the tummy. Now, when we're talking about a patient that has a lot of redundancy of skin here, a lot of fatty tissue and weak abdominal muscles, in that case, the full tummy tuck is indicated because we need to remove skin from one side or the other, redo the belly button, and correct the abdominal muscles all the way up. And the great majority of situations, the patients are more of a candidate for a full tummy tuck, especially after pregnancies and after weight gain. Now, there is something in between a mini tummy tuck and a full tummy tuck, which is called an endoscopic tummy tuck. And in this case, this is a situation where there's not a lot of extra skin, but there is some fatty tissue and a weak abdominal muscles. So what I do is I create a small incision so we can get rid of some minimal amount of skin. We disconnect the belly button internally, so the belly button is lifted from the abdominal wall, so the muscles can be corrected all the way up, and this belly button will be floated. In other words, it's displaced downward, but it can't be displaced more than 2.5 centimeters because it'll be funny to have a belly button down here. So the belly button will tolerate 2.5 centimeters of movement in a downward direction, so we can trim some of the extra skin minimally and do the full abdominal wall repair and the liposuction. There's very few people that really qualify for this procedure, and because most of the time the problems are a lot of extra skin, stretch marks, and things we want to eliminate. So that's that for now.